How many of you know somebody with fibromyalgia? Well, today we are going to talk about the backstory of fibromyalgia and how it is linked to past traumas. Then we'll talk about what fibromyalgia is and how it's in our heads. And then we'll talk about how fibromyalgia is usually misdiagnosed. I have fibromyalgia, and I'm here to tell you that it is in our heads, but it's not made up. First, we're going to talk about the backstory of fibromyalgia and how it's a chronic disease that sends widespread pain throughout the body. It is also linked to other diseases such as TMJ and IBS. The most common symptoms of fibromyalgia are fatigue, tingling hands and feet, digestive issues, concentration issues, memory issues, and digestive issues. There are 200 plus symptoms that are linked to fibromyalgia. Anyone can get fibromyalgia, but it is more common in women than it is men. There is not a factual known cause to what causes fibromyalgia, but according to the NHS at United Kingdom of 2023, states that fibromyalgia can be caused by abnormal pain messages, chemical imbalances, genetics, and triggers. Most people do not develop fibromyalgia unless it is triggered by significant stress, such as injury, giving birth, traumatic past. So what does fibromyalgia do? It's associated with persistent bone, muscle, joint, and soft tissue pain, as well as emotional symptoms that are caused by chronic stress, lack of sleep, the chronic pain. It is the same as lupus and rheumatoid arthritis. The only difference is that rheumatoid arthritis and lupus are destructive diseases. Fibromyalgia is not. So it does not damage any organs and it does not damage tissue. Next, we're going to talk about how fibromyalgia is in our heads, but it's not made up. The main reason why people think that it's fake is because there's no way to test for it. You kind of just get diagnosed with it. As well as there's no factual known way of what causes it. Besides that, it runs in family history and is linked to past traumas. Fibromyalgia is more of a blanket term rather than an actual diagnosis. What I mean by that is when you go to the doctor, you just tell them that you have a heightened sensitivity to pain throughout your entire body, and that you have a number of the 200 symptoms. You can just have a number of those, and it's just your body of reacting to the disease. So they'll take that and your heightened sensitivity to pain and just diagnose you with fibromyalgia. So let's readdress that it's in our heads. So I'm here to tell you that it is. I remember about 10 years ago, there was this guy that was talking about how fibromyalgia is, so there's nerves throughout our entire body. And so when we're touched or we're poked, our brain, our nerves, when those signals are to our brain processes it differently. So our brain is making us sick. So our heightened sensitivity to pain, so we don't process pain the same way others do. Brain imaging studies and other research shows altered signaling in neural pathways when transmitting or receiving pain signals. Finally, we're going to talk about the 200 symptoms that go along with fibromyalgia and how it usually can cause misdiagnoses. So for the most common misdiagnoses are depression, Lyme disease, rheumatoid arthritis, and lupus. Some people go up to 5 years searching for a diagnosis. Fibromyalgia is the most common pain symptom, chronic pain syndrome, and almost 4 to 12 million people can have it. It cannot be cured, but it can be managed through drugs such as duloxetine or anti-seizure drugs that will help reduce the pain, but it's not an all-do fix. There's other things such as physical therapy to help improve strength and flexibility, occupational therapy to do adjustments in the way that you perform certain tasks so it's less stress on your body, as well as there is exercise and sleep. So if you get adequate sleep, because one of the main symptoms is fatigue, If you get adequate sleep, that can help reduce that symptom, as well as exercise can help, in my own experience, can help you be less tender and stiff and help reduce the pain, because my doctor would always tell me that a body in motion stays in motion. As we end today, we learned that fibromyalgia is a traumatic disease, and that there's not a lot that there's done for us besides just dealing with the pain. There are some drugs that help reduce the amount of pain we're in, but it's not an all-do fix. We talked about the backstory of fibromyalgia and how it usually takes a traumatic event to cause the disease. We discussed that it is in our heads, but it's not made up. A lot of people would think that I faked my disease, or even sometimes still think that I faked my disease, because we can have long periods of remission and then we can go into a flare-up, what we call a flare-up. And I can be fine yesterday and be sick today. So a lot of people think that if you were fine yesterday and you're sick today, then like what caused it? And there is no known cause. It's a ghost disease, so a lot of people can't see that you're sick, so they don't think that you're sick. It's very unpredictable. So like I said before, I could be fine yesterday and then I could be sick today. So I wouldn't be able to walk. I wouldn't be able to lift my arms up. Even getting touched or hugged would be very painful to me. Then we also discussed how it's mistaken for other diagnoses because of the 200 symptoms that go along with it. So I'm going to leave us on that note of that is why I am going into occupational therapy, is due to the fibromyalgia that I have. And then here's my note cards.